Well, welcome to TCC Connections, and thank you for joining us today for our podcast on acne. My name is Cheri Garvin, and I'm an owner and pharmacist here at the Compounding Center. I'm your host for today's episode. Joining me is Megan Kilkeary, one of our pharmacists and an expert on supplements. As I mentioned, today's topic is teenage acne. We'll talk about the potential causes and some of the treatment options. But the information that we're going to share is educational and not really meant to diagnose or treat any patient. I think we can all agree that being a teenager these days is hard enough. Adding acne to the mix can really affect self-esteem. And I think most of us can probably relate to those years of worrying about breakouts and oily skin. So we do hope that you find today's information useful. Well, welcome, Megan. Maybe get us started by describing some of the causes of acne.
Sure. Thanks, Cheri. I'm really excited to talk about this topic because it really does affect such a large number of adolescents. I personally battled acne as a teenager, so if we can bring some insight into this subject and help people, that is definitely our goal. So the main cause of acne can be genetics, fluctuations in hormone levels, which we all know teenagers deal with on a constant basis. We can tell sometimes just on their personality how their hormones are going for the day. But hormone levels can play a huge part in acne. Stress, which we all know teenagers and adolescents are battling right now in our society. Even changes in humidity levels, changes in the weather, can contribute to or even worsen acne in people. Another huge component to teenage acne is diet. I can't stress enough the idea of you are what you eat. So foods that are high in sugar, caffeine, saturated fats, all of these fast foods that we're eating, these processed foods, these can lead to inflammation in our bodies. And this inflammation can significantly contribute to acne.
Great. Well, that was very helpful. And yes, I think sometimes we forget about the diet component to pretty every health condition, right? Well, we know that there are many prescription drugs on the market to treat acne. What are some of the concerns with the traditional therapies like the strong antibiotics and products like Accutane?
Sure. So the disadvantages to the antibiotics are that they're usually prescribed for a minimum of 30 days or longer for patients, and sometimes months on end. So long-term antibiotic use can kill off the good bacteria that's in our guts. And this good bacteria compromises a significant portion of our immune system. So wiping out these good bacteria, which are killing those off is associated with increased GI issues and increased inflammation. And going back to what I said before, inflammation is a huge component in acne. That's why, a lot of times with the pimples, that redness that you see, that's inflammation. So moving on to products like Accutane or the isotretinoin, the generic name, which is actually a vitamin A derivative. So the isotretinoin can cause severely dry skin, chapped lips, skin sensitivity. Many doctors will only even prescribe Accutane for patients during the winter months so that patients aren't exposed to additional sunlight levels during the summer. Females have to go on birth control in order to start the isotretinoin or Accutane. And there is also an increased risk of depression and unfortunately suicide in patients who are taking it, albeit it's rare. It has occurred. So these are things that we want to educate patients on before they're starting these prescription antibiotic or Accutane treatments, and just let them know that there are some other options out there too that might be good to start with before going the prescription drug route.
Great, great, very helpful. And that is true. I mean, I think it's important for everybody to understand the pros and the cons to every drug. So obviously, there is a need for drugs like Accutane and antibiotics, but you mentioned options. So I guess maybe talk to us about what options there might be if a patient or a parent doesn't want to jump right to those drugs that we just talked about.
Sure. And obviously antibiotics and the isotretinoin certainly have their place in the treatment of severe forms of acne. We don't want to see these kids get scarring and just have lifelong cosmetic issues, from severe acne. So they definitely do have their place, but it is important for parents and teenagers to know some of the other options. Our goal is to minimize breakouts and reduce the chance of scarring, obviously. So supplements can be really helpful in doing that. And some of those supplements include vitamin D, vitamin C, B vitamins, zinc, the omega-3 fatty acids, saw palmetto, and my favorite, probiotics. So I'll go into a little bit more detail on each of these and why they are helpful in adolescent acne. So starting with vitamin D, so studies have actually shown that vitamin D deficiency is extremely common in patients who are experiencing acne. So supplementing even for just 2 months with vitamin D can help improve the overall condition of the skin. Vitamin D, our population, you hear all the time, we're low in vitamin D. And even if you spend a lot of time in the sun, the vitamin D that we get from the sun isn't the kind that our body actually needs. So taking a good vitamin D supplement is important and can be helpful. Another vitamin is vitamin C, which is an antioxidant. And while it doesn't help directly with hormonal acne, vitamin C can be helpful as an antioxidant and an anti-inflammatory. And again, going back to the idea that acne is an inflammatory process of inflammation going on in our bodies. So anything that can tamp down on inflammation can help to reduce acne flare-ups. B vitamins are helpful in hormonal type acne. They play a role in enzymatic reactions with our hormones. So supplementing with the B vitamins helps to regulate those hormones a little bit, which then in turn helps to make the acne less severe. Zinc is another great one. I have even personally found zinc to be helpful to my skin. It decreases the oil production. Studies have actually shown by up to as much as 85%. So zinc is actually very useful in all different types of dermatological infections, but especially it's definitely one of the top ones that I recommend for acne. Another one I talked about was the omega-3s, which is in fish oil, another great option. So I know it might sound counterproductive to take an oil when a lot of times people with acne have oily skin, but the oil that's in the omega-3s does not cause your skin to be oily. In fact, it's very good for your skin. Omega-3s help to reduce inflammation. Another one that I recommend for hormonal acne, not only for adolescents, but even for older women who are having hormone fluctuations and then seeing breakouts because of that, is going to be saw palmetto. So that helps to balance out hormones, which we know play a role. And it also has anti-inflammatory properties as well that can calm the redness and irritation from acne. And probiotics, another one that I like to tell everyone to take for just about anything. My favorite supplement out there. So probiotics, I'm sure everybody knows now, are good bacteria, and they help to restore the natural balance of bacteria in our GI tract. So when you supplement with the good bacteria, it literally pushes off and kills the bacteria, the bad bacteria that can sometimes start to overgrow within our bodies. So there are bacterial components to acne, as we know. So probiotics, by taking over and flourishing in our systems and pushing out that bad bacteria, can really help to reduce acne through that. They also have anti-inflammatory properties as well. And then lastly, I know we touched on this, but diet is huge. These foods that we're putting into our bodies are causing a lot of inflammation that manifests itself as the acne. So foods that contain sugars, dairy, gluten, saturated fats, all contribute to this increase in inflammation. So ideally trying to cut them out or at least drastically reducing them should really help to impact the severity for patients that are experiencing acne breakouts.
Great, great. A lot of supplements there that do a lot of
Yeah,
things for multiple
yeah.
issues. You did mention diet, and it made me think of something that I know I get questions about, and I wanted to just bring this up. And it does have to do with probiotics because I will get customers ask, well, I eat yogurt all the time. Why would I need a probiotic? Can you talk to us a little bit about the difference between probiotics that they might get in their yogurt that they buy at the grocery versus probiotics that they would get from a capsule?
Yeah, absolutely. So, yogurt can be good for some people. I don't always like to recommend it for multiple reasons. Dairy can be very inflammatory to some people. Obviously, yogurt is a huge dairy product. So, even though yogurt does have the good bacteria in it, that dairy component alone can really exacerbate inflammation, number one. Number two, it does not contain high amounts of probiotics that you would get in a good quality probiotic supplement. It also doesn't contain all of the great strains that you can get in some of the supplements as well. So really you want to dose with a high quality, high dose, good probiotic. And you're going to get so much more benefit out of that than just doing yogurt every day.
Yes, that makes a lot of sense. And I know, unfortunately, a lot of the yogurts are full of sugar too, which you
Again,
mentioned is not a
yes,
good thing. So,
yes, sugar and dairy. So but some of our top two, inflammatory ingredients are in yogurt. So
yeah,
yeah, we think it's a healthy product, but you have to be really careful and read those labels and see what's in there. So yeah, but probiotics, yes, by far, a good quality probiotic is my favorite supplement to recommend. So.
great. Thank you. Well, I'm sure all of our listeners are learning stuff because I learned some things as you went through the vitamins. But let's say a person does really have bad acne and they've tried some of these options, but they're at the point where they really need either Accutane or antibiotics. What things should they be considering along with those medications or thinking about?
Sure. So I've worked with a couple of great kids that have had to go the Accutane route before. And, it can just cause severely dry skin and lips to the point where they're just in pain from it. So it's really important to have a good soothing lip balm along with a non-pore clogging moisturizing cream to really be diligent about and put on there while they're on the Accutane. I personally like to recommend a natural lip balm that we carry here at the pharmacy by a company called Skin Can Do. They have a great line of products, all natural ingredients, and just very soothing to the lips. We also carry a great over-the-counter facial cream here called Clarifying Cream, which is directly for patients that have issues with skin and oily skin. And it's extremely moisturizing while not being pore clogging. So I recommend those two items for patients that are using Accutane and having issues, with the peeling and the dry lips. So that can really affect their self-esteem a lot too, just as much as the acne itself can. So it's important that we take care of patients and make sure that we find products that they can use during their treatment to improve their self-esteem.
Yes, that is true because sometimes when we give medication, the side effect can be almost as bad as what we're trying to treat. So I think it's very good that the patient or the parent is even kind of prepped for what they might experience. And sometimes that makes it a little easier because they know it's coming and they know what to do. So great. Well, Megan, thank you very much for joining the podcast today. You definitely have shared a lot of great information. And I want to make sure to have your contact information in the podcast notes so people know how to reach out to you here at the pharmacy. And thank everyone for tuning into the Compounding Center Connections podcast. We hope you found the information helpful today. If you have any comments or questions, please feel free to reach out to me at cheri@compoundingcenter.com, and consider subscribing to our YouTube channel and our podcast channel, The Compounding Center Connections, and stay tuned for future episodes. Thanks and have a great day, everyone.
Cheri.